Okay, just one moment. So, hello students. Hello to all of you. Hello. I'm Dr. Pradeep Pawar, Professor of Anatomy, and welcome to the series of lectures of anatomy on YouTube, especially for you students. So, let us today discuss about the muscles in the front of the forearm and the nerve supply of those muscles. Okay, let us begin now. Muscles in the front of the forearm. Now, students, muscles in the front of the forearm, a very important MCQ topic. Muscles in the front of the forearm are divided into three sets. One is the superficial set, the intermediate set, and the deep set. Superficial, intermediate, and the deep set. Now let us understand the superficial muscles. Students, there are 5 superficial muscles. And do you know what is the origin of all these muscles? Yes, it's the medial epicondyle of the humerus. Medial epicondyle of the humerus. Students, be interactive. If you know, you answer. So it will be an interactive session. Okay. So the common flexor origin, it is known as, this muscles arise from the medial epicondyle of the humerus. Now, which are the muscles? Just have a look at this slide. Which are the muscles here? I'll put numbers. This is number 1, 2, 3, 4. So 4 superficial muscles, 1 intermediate, and 3 deep muscles. Superficial muscles, the first one, this is the pronator teres. Pronator teres. This is the flexor carpi radialis. Flexor carpi radialis. The third one, the third has a small belly and a long tendon. What do you call this as? Students, that's the palmaris longus. Palmaris longus. And the last one is present towards the ulnar aspect. So, iska naam kya hoga? Flexor carpi ulnaris. So, muscles in the superficial set, pronator teres, flexor carpi radialis, palmaris longus, and the flexor carpi ulnaris. Flexor carpi ulnaris. Now coming to the second set of muscles. मैं लिखूंगा ये, I'll write this down. Just listen. Second set of muscle is the intermediate set. Now which is this muscle? The flexor digitorum superficialis. Flexor digitorum superficialis. That's the intermediate muscle. And the deep muscles, which are these deep muscles? एक muscle होता है which begins from the radius bone. It begins from the radius, goes to the thumb. Does this for the thumb. ये क्या होता है बच्चों? What is this for the thumb? Flexion. So what is the name of this muscle? It's the flexor pollicis, and it's a long muscle. So flexor pollicis longus. Flexor pollicis longus. एक दूसरा muscle है which begins from the ulna. Begins from the ulna, comes here, divides into 4 tendons, goes to the digits. It is going to flex the digits. It is going to flex the digits. So what is that? Flexor digitorum, and it's a deeper muscle. तो क्या बोलोगे इसको? Profundus. Flexor digitorum profundus. And the last muscle begins from both radius and ulna. It is attached to both radius and ulna. It's a quadrangular muscle. Yes, what's that? Pronator quadratus. Pronator quadratus. So let me just jot this down for you, students. The superficial muscles. Okay, I'll begin like this. Muscles in the front of the forearm, we divide it into superficial muscles. The superficial muscles mein first is pronator teres. Pronator teres. And students, this pronator teres has got 2 heads. इसके 2 heads होते हैं. एक होता है superficial head and the other one is the deep head of pronator teres. The superficial head is also known as the humeral head. Humeral, because it arises from the humerus. The deep head is known as the ulnar head of pronator teres. Superficial and deep. एक humerus से arise होगा. The other one arises from the ulnar. Can anyone tell me, students, out of these 2 heads, the superficial and deep head, which is the head which is going to flex the elbow joint? Come on. Out of the superficial and deep head, which is the head which is going to flex the elbow joint? Once again, superficial head arises from humerus. The deep head begins from the ulna. Students, understanding? So who's going to act on the elbow joint? Superficial head. Why? Because it is going to cross the elbow joint, है ना? Superficial head elbow joint को cross करता है. Deep head doesn't cross the elbow joint. And between these 2 heads of pronator teres, there's a nerve which passes. Any guesses, बच्चों? Yes, that's a median nerve. Median nerve. So the nerve which goes between the 2 heads of pronator teres is the median nerve. And बच्चों, this median nerve gets compressed. It can get compressed between the two heads of pronator teres, and this is what we call as the pronator teres syndrome. Pronator teres syndrome. Okay, so what is pronator teres syndrome? It's the compression of median nerve between the two heads of pronator teres. वैसे बच्चों, what is the compression of median nerve in the carpal tunnel known as carpal tunnel syndrome? ये आपको पता है, ठीक है? So that's pronator teres. Nerve passing between the two heads, that's a median nerve. The second muscle is going to flex the wrist joint. Wrist joint. The wrist joint is also known as the carpal joint. So ये होगा flexor of the carpal joint. It's towards the ulnar. It's towards the radial side. Radius की तरफ होता है. So what do you call this muscle as? It's the flexor. Yes, बच्चों. It's the flexor carpi. Carpal joint is the wrist joint. It's the flexor carpi radialis. Okay, flexor carpi radialis. It is going to flex the it's going to flex the wrist joint. It's towards the radial side. वैसे there's one muscle which is going to flex the wrist joint towards the ulnar side. It's towards the ulnar. So flexor carpi ulnaris. Flexor carpi ulnaris. And the third muscle begins from the humerus. The medial epicondyle comes here, divides into 4 tendons, goes to the digits. It causes flexion of the digits. इसका नाम है flexor digitorum superficialis. Okay, flexor digitorum superficialis. ये हो गए 4 superficial muscles in the front of the forearm. Now coming to intermediate muscles. Okay, coming to the intermediate muscles. Which are the intermediate muscles, बच्चों? The flexor digitorum. Okay, I'm so sorry. One moment. This is not flexor digitorum superficialis. This is the palmaris longus. Palmaris longus. Palmaris longus होता है ना, it has got a small belly and a long tendon. That is palmaris longus. The intermediate muscle is flexor digitorum superficialis. Okay, that's flexor digitorum superficialis. So one is the superficial muscle, the second one is the intermediate muscle, and the third one are the deep muscles. Deep muscles. So which are the deep muscles? One begins from the radius, goes to the thumb. What is that? It's the flexor pollicis longus. Flexor pollicis longus. Second, it's the flexor digitorum profundus. And the third one is pronator quadratus. Pronator quadratus. ये ठीक है बच्चों? So these are the deep muscles. The one which begins from the radius, goes to the thumb, does flexion of the thumb. ऐसे याद रखना आपको. Flexor pollicis longus. A muscle which begins from the ulna, goes to the digits, causes flexion of the digits. A deep muscle, therefore flexor digitorum profundus. And the third muscle is a quadrangular muscle. That's the pronator quadratus. Perfect, perfect. अब I'll draw a slide for you. I'll draw a slide for you. Look at this. कैसे याद रखोगे इसको? Look, this is the radius. That's the easiest way to understand, students. That's a radius and that's the ulna. ठीक है? What is this muscle which begins from both radius and ulna? What's that? Pronator quadratus, which is attached to both radius and ulna. A muscle which begins from the radius alone, a muscle which begins from the ulna. ये कौन है? That's a flexor pollicis longus. That's a flexor digitorum profundus. So ये हो गए deep muscles. Coming to this superficial muscles, this is 1, 2, 3 and 4. 1, 2, 3 and 4. And ये है अपना intermediate muscle. That's our intermediate muscle. Clear? So this is the pronator teres, the flexor carpi radialis, palmaris longus. This is the flexor carpi ulnaris, and that's the flexor digitorum superficialis. Flexor digitorum superficialis. ये हो गया superficial muscle, ये हो गया intermediate muscle, and that's a deep muscle. Now बच्चों, there are two nerves here. Which are the two nerves here? One is this nerve here, and one is this nerve here. What is this nerve? That's a ulnar nerve. And ये क्या nerve होगा? That's a medial nerve. Ulnar nerve and medial nerve. Students, are you following? Now that's a slide. बस ये slide याद रखना आपको. You will understand the nerve supply of the forearm. That's very easy. Now Understand this. Tell me, where does the ulnar nerve lie? Students, आपको ulnar nerve देखना है. So what do? You just lift a muscle. Which is that muscle? Flexor carpi ulnaris. देखिए, just lift the flexor carpi ulnaris, and what are you seeing? Ulnar nerve. And this ulnar nerve is lying on which muscle? Flexor digitorum profundus. समझ में आ रहा है बच्चों? That means ulnar nerve is lying between which two muscles? The flexor carpi ulnaris and the flexor digitorum profundus. The ulnar nerve will supply these two muscles. ये दो muscles को supply करेगा, flexor carpi ulnaris and the flexor digitorum profundus. But बच्चों, but on the profundus there are two nerves. There are two nerves lying on the profundus. एक है ulnar nerve, एक है medial nerve. Now there are two nerves which are lying on the profundus. तो दोनों को profundus को supply करना है. Both the nerves would want to supply the profundus. Correct? How do they divide the profundus now? They divide the profundus into half. So which half is the ulnar nerve going to supply? Which half is the ulnar nerve going to supply? The medial half. The medial half. मतलब कैसे याद रखोगे इसको? Out of all these muscles, अब जितने भी muscles हैं, what muscles are the ulnar nerve going to supply? The flexor carpi ulnaris, below which it lies, and the flexor digitorum profundus, on which it lies. Okay, so these are the two muscles supplied by ulnar nerve. अब जितने भी muscles left हैं, all the muscles which are left would be supplied by which nerve? The medial nerve. You following this? अब what are muscles are left would be supplied by which nerve? Medial nerve. But again, students, again, medial nerve supplies only four muscles. It's not that easy. देखो. Medial nerve supplies only four muscles: pronator teres, flexor carpi radialis, palmaris longus, and the flexor digitorum superficialis. ये चार muscles को कौन supply करेगा? Medial nerve. Because medial nerve has to go to the hand. Medial nerve has to supply the muscles in the hand. So how many muscles is a medial nerve supplying the forearm? Only four muscles. Okay, तो अब बाकी कौन है? Who's left here? One. The flexor pollicis longus बाकी है. The pronator quadratus is left, and the lateral half of profundus is left. ये तीन muscles बाकी है. Ideally, who should have supplied this? The medial nerve. Ideally, medial nerve को supply करना था. But medial nerve supplies only four superficial muscles and goes to the hand. But before it goes to the hand, the medial nerve gives a deep branch here, bacha. And what is this deep branch? Ab sari muscles nikal do. You remove all these muscles. What do you get? The two bones, radius and ulna, and the interosseous membrane between the radius and ulna. And this nerve lies on the anterior aspect of the interosseous membrane. What do you call this nerve as? The anterior interosseous nerve. So anterior interosseous nerve is going to supply these muscles, the rest of the muscles. Okay. So this is supplied by anterior interosseous nerve. Clear, students? Is this clear to all of you? That's how you remember the nerve supply. That's the anterior interosseous nerve. So what is the anterior interosseous nerve? It's a deep branch of median nerve given after it passes between the two heads of pronator teres. Clear hai bachcho? Okay, that's how you remember the nerve supply. Now see some slides and just try to understand this. Once again, I'll just repeat this. Superficial muscles, pronator teres, flexor carpi radialis, palmaris longus, and the flexor carpi ulnaris. Intermediate muscles, flexor digitorum superficialis. And the deep muscles, one, flexor pollicis longus, the pronator quadratus, and the flexor digitorum profundus. Out of this, these two are supplied by ulnar nerve. आपको बस ये याद रखना है, ulnar nerve is lying below which muscle? Flexor carpi ulnaris, and ulnar nerve is lying on which muscle? The flexor digitorum profundus, the medial half. So these two muscles are supplied by ulnar nerve. अब ये जो चार muscles है, the one in red, that is supplied by whom? Medial nerve. And the one which are left is supplied by anterior interosseous nerve. And this anterior interosseous nerve is a deep branch of medial nerve. Perfect? Students, is this perfect? Just have a look at the slide once again. Have a look at the slide. These are very important MCQs, students. Look, I'll just mention this. Number one, superficial muscle, that's a pronator teres. Number two, that's a flexor carpi radialis. Number three, that's the palmaris longus. Number four, that's the flexor carpi ulnaris. Flexor carpi ulnaris. अब intermediate ये जो आप देख रहे हो, that's number 5. That's the flexor digitorum superficialis. That's number 5. Okay. Now just have a look at this slide, students. Look at this slide. This is a dissected specimen. What's this? Number 1, pronator teres. That's the flexor carpi radialis. That's the palmaris longus. And that's the flexor carpi ulnaris. है ना? Flexor digitorum superficialis थोड़ा सा नीचे होता है. That's an intermediate muscle. बच्चों, just have a look at this slide. Now, these are the deep muscles. ये deep muscles है. This is a muscle which begins from the radius. ये कौन है? Flexor pollicis longus. This is a muscle which begins from the radius, and where will it go? To the thumb. It will go to the thumb. It will cause flexion of the thumb. What is this muscle? Flexor digitorum profundus. And iske niche, what is this deep muscle, students? What is this deep muscle? Yeah. That's the pronator quadratus. Correct? So that's the flexor pollicis longus. That's the flexor digitorum profundus, and that's the pronator quadratus. What is this nerve, students? That's the ulnar nerve. And what's this nerve? That's the median nerve. Ulnar nerve and median nerve. Okay? Ab bolo, if I have to place a muscle here, students, if I place a muscle here, what muscle is this going to be? If I place a muscle here, what is this muscle going to be? That's the flexor carpi ulnaris. अब समझ में आ रहा है? That's the flexor carpi ulnaris. मतलब if you just lift the flexor carpi ulnaris, क्या देखोगे आप? What are you going to see? Ulnar nerve. And what is the muscle that it is lying upon? Flexor digitorum profundus. समझ में आ रहा है ये? Are you following this? So that's the flexor carpi ulnaris. मैंने इसे reflect किया. अब मैं क्या देख रहा हूँ? I'm seeing the ulnar nerve lying on which muscle? That's the flexor digitorum profundus. Right? And students, what would this muscle be? ये क्या muscle होगा? If I draw a muscle here, देखो, I draw a muscle here. What is this muscle? That's the flexor digitorum superficialis. अगर मैं superficialis को reflect करता हूँ, what do I find? The median nerve. And this median nerve is lying on which muscle? The flexor digitorum profundus. The median nerve is lying on flexor digitorum profundus. Right? And students, if you can tell me what is this branch of median nerve? Dekho, this is a deep branch of median nerve. What do you call this as? Anterior introitious nerve. That's the anterior introitious nerve. It's a deep branch of median nerve. Are you clear, students? Ye clear hai? Is this clear to all of you? So that's about the nerve supply of the forearm with the muscles in the forearm. Just have a look at this. What is this? Ye kya head hai? What is this number 1? And what is this number 2? Can anyone tell me this? So, number 1 and number 2. Number 1 is the superficial head of pronator teres. Superficial head of pronator teres. And what is this number 2? That's the deep head of pronator teres. Between the superficial and the deep head, what is the nerve which passes? That's the median nerve. We have median nerve. So what passes between the two heads of pronator teres? The median nerve. Dear students, is this clear to all of you? Any doubts? Any doubts you have, you ask me. Just look at this slide. Yes, slide bhi dekh lo. So it will be clear to you. Just have a look at this slide. What is this muscle here? That's a flexor pollicis longus. What is that? Flexor digitorum profundus. What is this? Ulnar nerve. What is this? Flexor carpi ulnaris. Ye kya hoga? Median nerve. That's a median nerve. And what is this muscle? Flexor digitorum superficialis. Am I clear to all of you, students? So today this was a very small topic. This is the front of the forearm with its nerve supply. Okay, out of all the muscles in the forearm, which muscles are supplied by the ulnar nerve, bachcho? Ulnar nerve is going to supply only two muscles. One is the flexor carpi ulnaris and the second one is the median half of profundus. In the forearm, which are the muscles which are supplied by the median nerve? The pronator teres, the flexor carpi radialis, the palmaris longus and the flexor digitorum superficialis. And which are the muscles which are supplied by the deep branch of median nerve? That is the anterior introitious nerve. One, the flexor pollicis longus, the pronator quadratus, and the lateral half of flexor digitorum profundus. Good evening, Maya. Good evening. Very good. Any doubts? Are you able to follow this? Yes, Maya. The rest of you also be interactive. Thoda sa interact kariye, so it will be easy for you. Okay, I'll just tell you one or two more things. Students, if you can tell me, what is this tendon of? Ye dekho, just see this slide. What is this number 1 and what is this number 2? Come on, Maya, if you can answer this. What is this number 1 and what is this number 2? Any guesses? Any guesses? So number 1 is the tendon of flexor digitorum superficialis. कैसे पता है? How do you know this? That's the tendon of flexor digitorum superficialis. And then number 2 is the flexor digitorum profundus. कैसे पता है अपने को? See, flexor digitorum superficialis, look, that's the finger, that's the distal phalanx, that's the middle phalanx, and that's the proximal phalanx. ये 3 phalanges हो गए ना बच्चों? Now, the tendon of flexor digitorum superficialis at the base of the proximal phalanx. At the base of the proximal phalanx, it divides into 2 ऐसे 2 slips में divide होता है, and this is inserted on the base of the middle phalanx. It is inserted on the base of middle phalanx. So the 4 tendons of flexor digitorum superficialis splits into two slips, and this is inserted on either sides of the base of the middle phalanx, right? Whereas what is this tendon? ये जो deep जा रहा है ये, what is this tendon of profundus? And where is the insertion of profundus बच्चों? It is inserted on the base of the distal phalanx, correct? The tendon of profundus is inserted on the base of distal phalanx. Just remember this, huh? So who's going to flex the distal interphalangeal joint? The distal interphalangeal joint. Is the superficialis going to flex the distal interphalangeal joints? No. The distal interphalangeal joint is going to be flexed by flexor digitorum profundus. Perfect, because profundus ka insertion is on the base of the distal phalanx of the fingers, and superficialis ka insertion is on either sides of the base of the middle phalanx of fingers. Yeah, to all of you. So with this, if you can answer this MCQ, students. Chalo bachcho, just answer this MCQ. A football player presents to your clinic with a swollen index finger. When told to make a fist, the young man can bend his index finger at the proximal interphalangeal joints, but not at the distal interphalangeal joints. Which tendon is likely ruptured in this injury? Yes, answer this, students. Easy, eh? Now you should be able to answer. If you know the insertion of the superficialis and profundus, yes, you should be able to answer this. So distal interphalangeal joint flex नहीं कर सकता है. So which is the tendon injured? The flexor digitorum profundus. It's the flexor digitorum profundus. Clear to all of you? Okay, fine, students. So I hope this topic is clear to all of you. I'm Dr. Pradeep Pawar, Professor of Anatomy. For more details of anatomy and to understand it more better, you can get into this PW MedEd. You can have this PW MedEd. There are lectures of MBBS First Prof on the app. Okay. For more details, you can log into PW MedEd. Thank you. This is Dr. Pradeep Pawar, Professor of Anatomy, signing off. Sign in for more videos on YouTube. Okay. Thank you to all of you. Thank you. Thank you, Maya. Any doubts anyone has?